The evidence-based CARES Dementia 5-Step Method for Hospitals online training and certification program provides high-quality dementia education for staff working in acute care settings. It is specifically designed to reduce costly adverse events such as delirium, falls, urinary tract infections, aspiration, pressure ulcers, elder abuse, and hospital readmissions. The program includes training in the evidence-based CARES Dementia 5-Step Method that can be used with patients with any level of cognitive decline. The program has been proven to increase staff sense of competence, approaches to dementia, patient care, and staff ratings for care-related questions. It has also been proven to decrease the average length of stay for hospitalizations.
When I think about what it might be like if I had dementia coming into the hospital, I equate it to if I was a patient in a foreign country. It's a very frightening thing for patients, and so we have to somehow have all of the employees that are working with these patients, whether it be our nurses, our physicians, our lab technicians, our nursing assistants, everyone that touches patients, have the compassion and somewhat an understanding of what it's like to experience dementia and how we can make it better for them.
Recognize patient behavior as a form of communication, not as something negative or challenging.
There's a common belief that dementia affects only memory, but in fact, dementia affects many types of thinking skills, including language, reasoning, and judgment. This module provides a glimpse into the experience of the person with dementia and offers some tips for adjusting your care to accommodate their needs.
Learn how a healthy brain changes over time and how many different areas of thinking, not just memory, diminish as dementia progresses.
I often find that patients that suffer from Alzheimer's would rather not answer questions than to get them wrong. So what I do is I just be very calm in my approach. I try to reassure them through the calmness of my voice. And I just try to be as sweet as possible is my biggest thing. Slowing it down, remaining calm, being peaceful. You know, that's the approach that I use. Sometimes I just get in the kitchen, I get carried away.
When the nurse asks if she is having pain, Kim Lee says yes, so he asks some follow-up questions. People with dementia might not have the verbal skills to explain how they feel. Plus, they may not be able to follow multiple questions or understand complex concepts, like rating pain using a number.
Learn specific techniques that translate to improved outcomes and satisfaction scores when encountering dementia-related behavior.
It can be difficult for them because they're not used to having all these tubes, and the tendency is to pick at it or pull it out.
If patients need their tubes hidden, like an IV line, IVs are pretty easily hidden either with we have like a stockinette that we can put over it.
Distraction is a big one. If they're an avid reader or certain TV shows, make sure those things are on.
Because patients are in the acute care setting for shorter periods of time compared to long-term care, and because they are often heavily medicated, it is even more important to incorporate the evidence-based CARES Dementia 5-Step Method. Although designed for patients living with dementia, it is effective for all patients. When you complete the training, you can take a fully integrated exam to get certified in CARES Dementia 5-Step Method for hospitals. In the words of the medical director of a 14-hospital organization, CARES is just good patient care.